Okay, you're listening to Stroke Warrior Radio. Thank you for tuning in today. I'm a stroke survivor myself, having had my stroke about 7.5 years ago. It's the goal of Stroke Warrior Radio to provide information for stroke warriors everywhere, whether you've had your stroke last week or 10 years ago. I'm your host today for our program regarding occupational therapy. Our guest today is Gina Kim, who is a neuroclinical specialist at Johns Hopkins Hospital. Hi, and welcome, Gina. Thank you for sharing your field of experience. How are you today?
I'm doing well. Thank you so much for having me on the show.
Oh, it's a pleasure. I really appreciate it. I've been reading a lot about you. I really enjoy what you've been doing. Let's get into the couple areas here. What are the minimal areas of occupational therapy focus? Is it fine motor skills, or is that, I think this is kind of dismissive, making it that simple, what occupational therapy can actually accomplish. Tell me about what occupational therapy really is.
I'm so glad you asked. It's actually pretty funny because in occupational therapy school, we have some time where we even talk about an elevator spiel, just because we touch on so much, right? So to say it simply is a challenge in itself because we do so much. So I will say that occupation isn't defined as work, which is what might be more commonly understood. But the way that we define it is basically whatever you think is meaningful. So for a child, their primary occupation may be to play and to learn through play. For an adult, maybe somebody who's transitioning into their college years or, post high school, it may be really looking at getting a job, or maybe it's going to college and how to be a successful student, or maybe both, right? And as you get older, your roles may change, but what we want to focus on is what is it that gives you a sense of purpose when you wake up every day? What is it that's meaningful? So yes, it could include fine motor for the student who needs to know how to write or type on the computer, or for somebody who is really invested in sewing or making something with their hands. But it could also be anyone who might want to learn how to use their arms to hug a person again. Or it may be someone who wants to learn how to ride a bicycle, right? So I feel like whatever it is that is meaningful to that individual is what would define their occupational therapy program. In other words, I will say that we do look at everything from the task performed. So on a bigger scale, it could be an activity or a profession, but it could be things that lead up to your functional independence, like your basic self-care routine, dressing, bathing, brushing your teeth, doing your hair, anything like that. But we could also take a look at performance skills. And there we would take a look at how you do motorically, how well you're moving, how strong you are, how coordinated you are. But it could also be how much you can see, or how you're even interpreting what you see to navigate your space, to then even your cognitive skills. Like, what are you remembering in that recipe when you go to make your favorite roast, or the sequencing or the specific ingredients and the measurements that you're using, right? So there's so much overlap in motor, cognition, vision, behavior, and things of that nature. We really try our best to take a look at the whole person.
So it's a full person approach. I like that a lot.
Yeah.
So in other words, you've explained what OT is. What's OT mean to you? I mean, as far as your background and those kind of things, why are you doing it? What got
Right.
you into it?
For me, so I specialize in stroke and traumatic brain injury. So I think for me personally, it means it's helping an individual determine what their immediate goals are and helping them find that sense of functional independence and that self-confidence to really reclaim their sense of independence. So in most cases these days, I work with individuals who survived a stroke, and oftentimes there are certain barriers they have to work through, whether it's stiffness in their arms or if it's a weakness in their body, how they're managing from walking to and from a certain destination, right? And then really what they're doing outside of therapy. What is it that they're doing to fill their days that are meaningful, that will give them a sense of inspiration, creative expression, that sense of fulfillment and belongingness with their family and friends.
That's neat. I like that. Well, there's a misconception people have about OT that it's just about the arm and hand. My interpretation of what you've said so far, and I don't know if it's fair to say, but occupational therapy is what occupies their day, and that it's what OT primarily deals with. And I've heard it a lot lately that I didn't hear in the beginning because I didn't do much occupational therapy, is ADLs. Would you describe that for us?
Sure. So ADLs are activities of daily living, and you can think of it as your basic self-care routine. What is it that you do every morning or evening to help maintain your hygiene and your health? So it's split up into different categories. There's upper body dressing, lower body dressing, there's grooming, and depending on what you would typically do, right?
Okay.
We would be sure to include whatever you would define as important grooming skills. There's bathing or showering. There is, and then toileting, of course.
Oh, okay.
Right. So it's basically your basic functions that would help with you get your day started or wrap up your day. And then again, the different levels that are included really defined by that individual. Right.
Okay. Okay. And speaking with other stroke survivors, when I told them I was going to be talking to you, they mentioned a couple things that kind of surprised me. That they said that arms and fingers are harder than, for example, legs to rehabilitate. Why is
Yeah.
that true?
So there's also what you might want to consider is the return of the neurological pathways. Most times you tend to see return from proximal to distal, meaning you might see people have improved core activation. So you might see a little bit more movement in your shoulder, sometimes even in your elbow. For those who have a lot of stiffness or stiffness that even leads to hypertonicity in your flexor group muscles or your extensor group muscles, it could also lead to spasticity. And for those, the more vulnerable joints seem to be more impacted. So somebody who has more return in their shoulder and their elbow might have greater strength in those larger muscles to break through to create visible movement. But for somebody who has a lot of spasticity, there are more vulnerable, smaller joints and muscle groups within the wrist and hand and fingers. So you may see that there is some activation, but it's not strong enough to oppose the force of what is basically a disruption to your typical neurological pattern, right? So if there's a lot of stiffness in your hand being fitted, the muscles that would open your fingers are not strong enough to oppose those forces. So you tend to see return in the wrist and hand a lot later. Ooh, excuse me, there's a bee. Oh, I hope you can edit that part out.
Yeah, I will.
Oh man. But right, just kind of finish my thought there. So sometimes people might feel more strength and motor return in their shoulder and elbow before their wrist can. But in some unique cases, return comes from distal to proximal, meaning they see movement in their fingers and wrists before they see movement in their arms and their elbow, or their shoulder and their elbows.
Okay.
So another thing that has been discussed in research is the fact that proprioceptive input could help with motor reorganization, which will help with motor control. And
Okay.
that's basically the idea of a sensory motor feedback loop. So you're looking at the weight of your body in standing being sensed through your feet, your legs, and then your core, right? So
Okay.
that you know where your foot is because you get that visible and motoric feedback that you might be losing your balance, right? So you have more opportunities to know how you're positioning your foot and your leg and how that immediately impacts your ability to stand, either standing still or with movement, and then eventually with ambulation or walking, right? So when you're looking at legs, there are larger muscle groups, there are more opportunities to practice proprioceptive input in seated or standing as you're
Okay.
moving, right? But with the
Right.
arms, we don't walk on our hands, so we don't really get that opportunity as often. And they're smaller muscle groups, so they're less stable than your leg. So we try to target motor return in your arms through weight bearing in occupational therapy. So that might look like looking at bed mobility skill, right? So we might help somebody go from a seated position to laying on their side to then getting on their back, like either on the mat or on their bed. And that helps with understanding where their arms are or how they could activate it to position it.
Okay. Okay. I appreciate that. Quite. I want to jump a little bit to from my reading of your publications or writings that you've done. One of the biggest things that I was very appreciative of, because I didn't find this out till later in my recovery, is the team effort. That making it is the most effective treatments in occupational therapy, physical therapy, and all of them comes from an open, honest, and collaborative effort between a therapist and a patient relationship. Could you, you've written about that before, so I'd like to hear more about that.
I love that you brought that up because right in our recent publication we talked about the importance of high intensity neural rehab using a team-based approach. And really the idea is that we can do well on our own, but we could be so much more impactful and we can do so much better when we work with the right players. We have been exposed to a certain amount of education within our training in OT school. And there's definitely crossover with what physical therapists are doing or what speech therapists are doing or even counseling. But we have also recognized the importance of referring out. We only get so many visits, so many minutes and hours with the patient that it's better to divide and conquer in a way, right?
Okay.
So I think what helps in creating a comprehensive rehab program for an individual is really to understand them from all angles that make up their identity. But then at the same time, it's calling in all the team players that would help assess and create a treatment program that is going to be beneficial to them. I'll tell you that this weekend I took a continuing education course, which is something that we have to do as licensed practitioners. in order to stay abreast with the new research and clinical practices that are going to be really helpful in treating this population. And it was really interesting because it was really just about breathing and postural support. And there were PTs, OTs, and speech therapists who attended this course. And even though we all had such different training, everyone found this continuing education course to be valuable in that we all left with certain clinical pearls that would impact our discipline specific approach in helping somebody who is recovering from a neurological disorder, right? So to be a little bit more specific, we all take a look at anatomy and the muscles that make up your core, including your diaphragm. And then we also take a look at movement, right? And movement could be at the lower part of the body where you're looking at walking, upper parts where we're looking at movement of your hand. But what's interesting is that breath support and core activation starts at the very bottom of your hips at the pelvic floor. And it goes all the way up to the top of your, even above your shoulders where the vocal cords are.
Oh,
To take a look at how pressure is maintained within the core to help with speech production, phonation, arm movements, leg movements, and even how you're paying attention visually, right? So you're taking a look at the entire body and how multiple players within the treatment team could really make an impact on looking at the person as a whole. And it's, one more thing to add to that is that everybody has their own discipline specific rehab goals that are established with the patient. And I think the beautiful part of this is understanding what we all do in each discipline. So I think it's helpful for me to know what my PT and speech counterparts are doing, because then I can start thinking about, okay, how can I help my patient achieve their OT goals, but still complement what they're doing in PT and speech so there's no confusion, but more crossover and continuity between what we're doing and what we're trying to achieve.
that's fantastic. Is that something that's being developed in the near past or in the recent past? It's the wrong way to say it, but is that something that's coming about new, and is it becoming more prevalent?
I think it's been around for quite some time. I think that I have seen a lot of research articles that promote multidisciplinary care from various settings across the continuum of care. So that might be in the hospital setting where somebody is admitted into an acute care service line or progressing to inpatient. And then I'm on the outpatient floor, so I'm treating patients who have already been discharged home and they're still coming in for therapy. But the common thread is that multidisciplinary care starts as soon as they walk through those hospital doors to the time they even leave the hospital, and hopefully even go between outpatient discharge and then into community reintegration. So again,
Okay.
we want to look even beyond discharge, because what we want to do is help promote a healthy lifestyle that will reduce those risk factors that contribute to rehospitalization. So we really have to take a look at an all-inclusive rehab approach that takes a look at why they even started off at the hospital, and then what we could do to help reduce them coming back to live a fulfilling life, doing the things that they want to do outside of the hospital.
Okay. And okay, I guess the next question is, what are the questions that the patient needs to ask and what questions do you wish they would have asked you early on in their recovery? And what is the outline that you suggest to patients now when they are discharged, what their responsibility is?
I think it's a really, I think this is a great opportunity to talk about why education is so important, right? From both ends. I think this could be a sensitive topic because I think with somebody who never asked to be in this position, right? Most times these types of catastrophic changes are unexpected and never desired. So I think it's good to note the natural progression of recovery, and that includes just understanding what's happening to your body, right? So I would say just to encourage more grace as somebody who just recently survived something like a neurological event. Be graceful in that sense that you don't have to worry about hitting a checklist and making sure that you do things on a list from A to Z, but really just allow yourself to heal emotionally, to accept the changes that have occurred. Okay. And then so when you're ready, I think it would be good to talk about what it is that defines your current status right now. What are your current impairments? What is it that you could do in your daily routine, right? So already thinking about the end at the beginning. Try not to identify as a patient, but think about what you have to do to reclaim your sense of independence. Whether it's, X amount of minutes spent on an exercise, or how you can turn those exercises into a functional task, right? So in the hospital, you might be committed to a specific schedule for therapy, but maybe consider how can you turn therapy into your home routine so you're basically hitting two birds with one stone, right? You're
Right.
trying to not only work on your bicep curls, but how can you work on your bicep curls as you're doing laundry and loading the machine or unloading the machine, right?
Oh, yeah.
So talking about that practical application and already essentially like taking that baton from the therapist and taking it into your own hands where you're preparing yourself on the next steps that you need to take to further progress your recovery process. I think it would also be good to consider what other clinicians need to be looped in, right? So we were talking about the multidisciplinary approach, right? If you're seeing that you're getting one discipline or more, ask about opportunities for working with other therapists that may serve you, if appropriate, right? And so that could be through rehab, it could be a recreational therapist, it could be even a personal trainer outside of the hospital, right? Seeing if your physical therapist would be willing to work and train with a personal trainer that's local who could see you a little bit more frequently outside of insurance, if you have the resources, right? Looking at community-based resources, what organizations are out there that could help you stay active and socially engaged where you're reducing the risk of depression. Create opportunities to talk about looking at solution-based approaches to help with figuring out what it is that you could do given your whatever barriers you may be experiencing, right?
Okay.
If you want to talk about other healthcare professionals, I work closely with a lot of neuro-optometrists who help people understand not just what they're seeing, but how they're interpreting what they're seeing, and how that impacts functional mobility, right? There's also a certified driving rehab specialist who can help people look at their motor, cognitive, and visual skills and how to maybe consider going back to driving if appropriate, right?
Okay.
And if whatever reason there may be certain risks where return to driving is not recommended, you can have a discussion about what you could work on to try to build on those skills to then maybe consider other options.
Okay.
Right?
Okay. So it's a real one of the things I found in the beginning of mine is I didn't, I was so frustrated, angry, and upset about having the stroke that I forgot to ask questions. How do you
Yeah.
how do you encourage a patient to do that?
Oh man, I think, yeah,
I know it's
you know,
it's
I,
a tough one.
it is, it's so tough because I think it depends on the person
Okay,
and their emotional readiness for having these types of conversations. I will be completely transparent with you and tell you that there are some individuals who um, were motivated and so willing to show up to therapy, but they were still very much angry. They were angry, and I don't think that they were really ready for having those conversations. So I think just kind of testing out the waters, and really allowing yourself to have those times of self-reflection, I think will help with um, what you're willing to hear and listen,
okay,
right? Um, I think the best option would be to talk to your doctors, your therapists, and other clinicians to see if a rehab psychologist or a counselor or a neuropsychologist would be something to consider,
I didn't know
right?
there was such a thing as a rehab psychologist.
There are.
Oh
I
wow,
think it's because it's such a complicated point in someone's life that there's a need for care coordination and strategic planning in that regard. We
okay,
want so much information to get out to each individual, but we appreciate the sensitivity of timing and how effective it could be in knowing the right things to say at the right time. So I
okay,
think getting a social worker involved, a case manager, a rehab psychologist or a neuropsychologist or a counselor. Um,
okay.
I mean, I think that there are a lot of people out there who are willing to help, and we all want to make this process a little bit easier so that an individual can rely on other resources to help guide them through this. I think it is just understanding what resources you have available to you, and then also a lot of creative thinking to navigate it.
Okay. So for me, it boiled down to the only silly question is the one I didn't ask. I mean, there's a fear, I think, that we all had to
Right.
deal with. So
hmm
anyways, what would you, is there anything that you can add or finish with here about um, the broad subject of occupational therapy? I mean, you've touched on so many things, like the mental health aspect, the physical therapy aspect, the pharmacy. That's something that I've discovered, and putting all this radio together, is that pharmacy is another place we need to include on our team. Anything you want to finish with about occupational therapy for this session anyway?
Yeah, I will say that it does kind of tie into the roots of OT, where we started with mental health. And I would say that mental health plays such a huge role in someone's recovery. So I would say that, I would like to encourage other survivors out there to really take a look at where you are spiritually and with your mental health, because I think when there's a lot of anger and resentment and just not, I don't know, like if there's not a lot of acceptance for the stage in the recovery process that you are, it makes it so much harder for you to try to be receptive to other recommendations and strategies to cope and adapt to this new way of living. And I don't think that I don't think it's the end. I feel like there have been so many survivors who I spoke to who talked about um, their adaptability. And most times people said that that pivotal moment was when they accepted their current status and
Right.
that they were not going to let their diagnosis define them. They made it a point to say that this is not their ending, to their story that they're going to do something about it. And that sense of motivation was so empowering to themselves and the people around them. I'll end this with a quote from one of my patients. There are so many who shared their mantra with me in helping them get through the recovery process. And one individual said, "I can shock the world." And I think just having that fire was so incredible, because he wasn't going to limit himself on what anyone told him. He just had this internal fire to keep pushing through.
I like
I Yeah, I would encourage anyone out there to really find that mantra and stick with it, because we will have those days that are going to seem darker than others. We will have those moments where we feel defeated or very heavy, right? I hear a lot of disappointment or frustration. So hang on to a certain positive note or mantra that's going to give you that strength to keep pushing through.
That's beautiful. Thank you very much. Gina, I hope we can do some more sessions like this. The information you've provided, I mean, it's stuff. I'm getting choked up here because it's stuff that I wish I would have known during my early recovery. And I hope that it helps other people as well. I want to thank you, Gina.
Yes.
I hope you have a great day and a great week. And we'll be talking soon, I hope.
Thank you. It was honestly a pleasure to be part of this. So thank you for the invitation to participate.
Thanks a lot. You all have a good day now. Thank you. Stop.